Welcome to Adapt and Class. This is pharmacology for nurses. These are psych medication you should be familiar with for your nursing school if you probably in class be able to know and at least have at the back of your mind before you go and take the test. The first medication we need to know is an SSRI, sertraline. This information I'm telling you, you can use it for any SSRI, so don't limit yourself. If you need more content, check Adapt and Class. I have free videos on psych medication. Forward, SSRI are used for depression. They can also be used for anxiety. It can also be used for PTSD or obsessive compulsive disorder. So you have to be familiar with them, know what they use for, and other thing. What is the main idea of this medication? They are serotonin receptor inhibitor. They inhibit take away of your serotonin. So your serotonin need to be at a certain level for your mood to be specific. If the level is low, you get into trouble. So this medication allow you to maintain higher level of serotonin, and therefore that control your mood. Key fact, NCLEX is going to ask you, don't forget it. Trust me, these are key. It takes 4 to 6 weeks for them to work. They don't just work like that, but it takes some time for the concentration to build up before you start to have regular relief from it. You have to watch for key things. The board is going to ask you if you combine it to anything that is going to increase your serotonin, you develop serotonin syndrome. And this is usually all your symptoms goes up. You have tachycardia, you'll be sweating, you have clonus, GI symptoms. You don't even have to memorize. You can see that the individual is not normal. All the symptoms keep on going up, upgoing symptoms. Therefore, you know they have serotonin syndrome. One medication drug that people you see it in NCLEX is St. John's wort. Increases your serotonin, therefore you should avoid it. There's other things associated with that. Initially, when you start taking it, you're going to lose weight. Then you gain weight. So remember, lost weight initially, then gain weight. It can also cause insomnia. So you got to take it in the morning, not in the night. Sexual dysfunction is going to go down. Your libido go down. So these are things they always ask you. And of course, suicide is number one. Therefore, when you prescribe this medication, 2 weeks you need to see the patient. Otherwise, they'll develop suicide. Why? They'll get all the energy they've been looking for, and then they will perform the things they've been thinking about to do, all the bad stuff. Therefore, see them every 2 weeks as soon as you start the medication to be able to assess for suicide ideation. What is the mnemonic? SSRI. The S, suicide. S, serotonin. Watch for restlessness, diaphoretic, all the upper symptoms, and insomnia. So take it in the morning. These are things you should be familiar with. The next medication is benzodiazepine group. I use example as lorazepam. The key thing is they are used for anxiety, right? They can also be used for alcohol withdrawal. They are used in acute state when you have seizures, right? When you have seizures, you don't use anti-epileptic. In acute seizures, you use these medications to slow down your brain. That's what they do. Benzos is going to make you go slow your brain down. You also slow your breathing. You also slow your movement. Therefore, it causes sedation, respiratory depression, and the biggest things about them is dependence. That's why we don't take it for a long time. It's temporary. To patients on benzos, they can develop dependence. There's other options you can choose. If you need more on that, you can try Adapt and Class video on mental health. You see, you need to know other medications that does not cause dependence, but they are also used as what? Anxiety medication. They are for short-term use. Don't forget the antidote, flumazenil. Don't forget the antidote, flumazenil. Everybody make mistakes. Most people make mistake and choose naloxone. Naloxone is for what? Opiate. Flumazenil is for benzos. One medication herbal medication you should watch for is valerian root. Valerian root as ingredient like benzos. If you combine it with it, you get into trouble. Don't also combine any downants like alcohol with benzos. What is the mnemonic? Benzo slow you down. You slow the brain, breathing, and movement. That is the concept here. Next question. Haloperidol. This is antipsychotic. It's used for what? Schizophrenia, psychosis, and agitation. Use it in the hospital all the time. How does it work? It blocks a bunch of dopamine compared to serotonin. There's a bunch of side effects. I don't have to list all of them. They have antihistamine effect, anticholinergic effect, so many side effects. But what your board focus on is if they're going to cause neuroleptic malignant syndrome or extrapyramidal syndrome. So you have to know what those are. Those are the one you focus on. The pyramidal syndrome, usually symptoms are associated with what we call ADAPT, acute dystonia, akathisia, Parkinsonism, tardive dyskinesia. Like I say, if you need more content related to that, check ADAPT and CLIS. But this is the pharmacological aspect. It can also cause NMS. For the NMS, the key thing is muscle rigidity, fever, and altered level of consciousness in associated with hemodynamic instability. Blood pressure goes up and down, tachycardia, and they have muscle rigidity. What do you do with the EPS? You give them anticholinergic or benztropine. Okay, if they have muscle rigidity, you got to stop it. Either you can use bromocriptine or other medications like dantrolene will be used for NMS. So these are content you have to be familiar with. Haldol, high risks of what? EPS and NMS. That's the key. Okay. The next one is clozapine. It's also an antipsychotic, but this is a second generation antipsychotic that block more serotonin than dopamine. So that's the content related. It's atypical antipsychotic. Black box warning, agranulocytosis. It decreases your white count. There's a bunch of medication that causes agranulocytosis. One of them is clozapine. What do? Check their white count, daily lab to make sure, or weekly lab to check their white count. Therefore, any signs of infection is your priority. Otherwise, don't worry about anything. They're going to have drooling. Don't worry about it. They're going to gain weight. Don't worry about it. If you see drooling in clozapine and you pick it as a priority, is wrong, because when you take clozapine, you have hypersalivation and drooling is expected. The biggest one is what? Agranulocytosis. So I call it clozapine. C, check. L, leukocytosis often. That's how you can memorize clozapine. Check leukocytosis often. Lithium, like I said, these medication I'm picking are like must know. If you don't know anything about mental health, this medication should be at the back of your head. When you wake up in the morning, be able to tell me all the things associated with them. That means you're likely to see them. Lithium, bipolar. It has a narrow therapeutic index. That means bad side effects. A lot of toxicity, a lot of signs affect your neurological symptoms, but don't worry about it. They're going to ask you priority. Therefore, what is the priority for lithium is GI symptoms. I don't worry about slurred speech, hallucination, all the signs and symptoms associated with your neurological symptoms. Care more about what? GI. So number one symptoms, if you have nausea, priority. If you have diarrhea, priority. If you have loss of appetite, priority. The key thing you teach them is what? Consistent amount of what? Water and consistent amount of what? Sodium. Don't increase it. Don't decrease it. Always same. Stay cool. Same amount of sodium you take every day, consistent. Increasing it will cause a problem. Decreasing it will cause a problem. The word is consistent. What are medications you should avoid? They're going to affect your kidney. NSAID affect your kidney. ACE inhibitor affect your kidney. Hydrochlorothiazide affect your kidney. they're going to increase lithium toxicity. So stay away from it. The mnemonic is LIT. L, level, intake of what? Salt and water. T is the toxicity, and the headache is one of the neurological symptoms, but the buzzword priority is GI symptoms. Methylphenidate. Come on, man. They're going to ask you. They are for kids. Very good question. If you check the Q bank, there's a bunch of questions of what? Methylphenidate. If you check my Q bank, I ask a bunch of questions on this. Used for ADHD, right? And you can use it for narcolepsy. But what is it? It's a stimulant. Like I give you something that will stimulate your central nervous system. So your symptoms is going to go up. Those are not priority. All your symptoms will go up. But don't worry about it. That's why your heart rate goes up. It will make you it causes insomnia because your symptoms is up, right? You're going to lose weight. Why? It decreases your appetite, and therefore it causes growth retardation in kids. Those are your priority because ADHD are used in your NCLEX or in your nursing school. They'll ask you a question about a kid, and this will affect them from growing, and this will suppress their appetite. Because it causes insomnia, we got to take it in the morning. There is a break period when the medication is affecting the kid's growth. The doctor will provide medication holiday to allow you to grow. Okay, so you administer after meal early in the morning, right? So Ritalin, what does it do? It raises your brain because it's a stimulant, but and it makes you focus. But what does it do? It suppresses your appetite and your sleep. This is the key about methylphenidate. 6 medication, content-based. I need you to master them, and you will never forget mental health pharmacology. How do we apply? With the question, which finding require immediate intervention by the nurse? The client with schizophrenia is started with what? Haloperidol. Which of these do you think we should prioritize? Which of these should you worry about? If you have 1 second, which finding should concern you? Dry mouth, anticholinergic effect. Ignore it. Mild tremor, expected finding. Shuffling gait, that's extrapyramidal symptoms. That's bad. Drowsiness is suspected because of antihistamine effect. Therefore, shuffling gait is unexpected. It's extrapyramidal side and symptoms. Therefore, number 3 is your answer choice. Which statement by the client indicate a need for further teaching? They're saying something wrong. These are how you answer question from the back and find your keywords. Saying something wrong. And next is reviewing discharge teaching with the client. Prescribe what? Lithium. I told you lithium key is sodium and water and GI symptoms. Sodium, water, GI symptoms. And don't do anything to affect your kidney. What is he saying? I will drink plenty of water each day. Excellent. I will avoid ibuprofen for pain relief. It's going to affect your kidney. Excellent. It does not need further teaching. I will stop taking my lithium if I start vomiting. GI symptoms. That's early signs of toxicity. You need to talk to your doctor. Don't get trapped saying they're stopping the medication so it's good because they're vomiting. No. You should not just stop. You should talk to your doctor. I will have my blood level checked regularly because he has a narrow therapeutic index. You see how I answer the question? Number 3 is your answer. But you should be able to tackle each question based on your content you bring to the table. Which is the priority Nancy action, right? That means you have to be sharp. Be sharp means you're watching. If you have 1 second, what do? A client taking clozapine report a sore throat and fever. You know about agranulocytosis associated with this medication. Therefore, what do you tell them? You know it's a bad thing if they have a fever. Therefore, you tell them to use salt and water goggle to help with their throat as if they have upper respiratory infection. Do you document and schedule follow-up labs? Is that okay if you have 1 second? Hold the medication and notify the provider. Do you think is a good idea? And then encourage increased oral fluid. When you see fever and sore throat, those are signs of infection. These are what? bad problem in the patient taking clozapine because they have what? Agranulocytosis. It's a sign of agranulocytosis. Their white count is too low, therefore they're having upper respiratory infection. You should notify the doctor. Hold the medication. Don't give it to them. And then she's teaching a parent of a client new prescribe what? Methylphenidate. With statement indicate understanding of the teaching. Go with your content. Go with your buzzword. Methylphenidate. Tell yourself it's a stimulant. As a stimulant, it's going to suppress my appetite. It's going to what? Cause growth retardation. And I need to take it in the morning because it causes insomnia. Otherwise, my heart rate will go up, my blood pressure will go up, all those things. I don't care. What is he saying? I will give the medication right before bedtime. Wrong answer. I should offer snacks instead of full meal. Supposed to eat. It does not answer the question. My child might gain weight on this medication. He's going to lose weight. I will give the dose in the morning after breakfast. Good understanding of the teaching. Kid is going to lose weight. Why do you give them snack instead of full meal? It is not going to gain weight because it suppresses their appetite. You should take it early in the morning after breakfast. Content based, right? And the last one. And this is providing education to a client prescribed what sertraline is a SSRI. Which of the following statements should be included in the teaching? Select reply. Go with your content. You know SSRI. You see, I never use the name sertraline. I just ignore it. I identify it and I say, oh, this is SSRI. What do I know about them? It will take 1 week before I feel the full effect. Wrong answer. This is a trap. It takes about 4 weeks. 1 week is not enough. Therefore, this teaching is a wrong teaching. Don't include it. I should limit alcohol intake while taking the medication. You should never limit alcohol intake. What do? You should do what? Completely eliminate it from your system. No limiting at all. Number 2 is wrong. I can stop taking it as soon as I feel better. Well, you should not stop taking it. Keep on taking it, otherwise you get rebound symptoms. I may have decreased interest in sex. That's true. These medication may cause weight loss the first few weeks. That's true. Before you start gaining weight. So 2 and 4 and 5 are right. I will cool myself if I'm sweating profusely. That's a trap. When you're sweating profusely, that means serotonin syndrome. You should stop taking it. You shouldn't take it anymore. You should notify your doctor, go to emergency room. This is how they use the content, and then they turn them into an answer choice. And then if it try to trap you, but go with your content and figure out what this is going on. This is adapting place. Once again, if you're hearing my voice, this is adapting place. If you want to join our crash course, these are the information. You can take a picture, but these are the contents we'll be mastering. Cardiology, GI, respiratory, endo, mental health, maternity, prioritization, infection, pharmacology, and neuro. A bunch of information in a very short period. So if you're trying to take your NCLEX, you're having problem, and we focus on NGN, you have access to the video for 75 days, and then a Q Bank for free that you can practice over 3,000 questions. Take care of yourself, and thank you for watching, and good luck. All the best of luck.